Today we are discussing about histology of teeth. We know that the teeth is having an upper area that is called which is present above the gum, we call it as crown, and which is embedded in the gum, we call it as root. So this is the crown and this is the root, and the major part of the greatest part of the teeth, it is formed by a substance, hard substance called dentine. So this is the dentine. Okay, this is the dentine, and the major part of the root, it is formed root knot, and the major part of the teeth, it is formed by a hard substance called dentine. Here in the crown region, the dentine, it is covered by a hardest substance that is called enamel. This is called enamel. So above the root, these are the gums, right? These are the gums. Above the root, above the gums, this is the crown part of the teeth, and here above the dentine, in the crown part, it is covered by a hard substance called enamel. The enamel, it is made up of calcium salts, calcium phosphate and calcium sulfate, and these salts, they are arranged in the form of hydroxyapatite crystals. We know that in the enamel, this enamel, it is developed by a layer of cells. This enamel, it is deposited by a layer of cells called ameloblasts. This enamel, it is formed by a layer of cells called ameloblasts. These ameloblasts, they form a hardest substance over the dentine. Above the crown, above the gums, we call it as enamel, and this enamel, it is formed by a cells called ameloblast cells. Okay, and coming to the enamel, when we take the microscopic section of enamel, we know that these ameloblast cells, they form the enamel like similar to the formation of bone. We know that the bone is formed by one layer, and after one layer is formed. So in enamel, we can see these layers as lines. In enamel also, these ameloblast cells also, they form one layer of enamel, and again they form another layer of enamel, right? So these layers of, we can see as fine lines in the enamel. These lines are called lines of Régis. These lines are called lines of Régis. So when we take the microscopic anatomy of the enamel, we can see lines here, microscopic lines here. These are nothing but the one, because of the deposition of enamel by one layer after one layer, we can see these lines. We can call these lines are lines of Régis. Okay, and so we know that this enamel covers the dentine over above the gum region. So the crown, in the crown, the dentine part, it is covered by enamel in the crown region. What is crown? The teeth we are able to see above the gums, we call it as crown. And the deeper part we call it as below the gums. The deeper part we call it as root, and the root, the dentine part, it is forms the greatest part of the root also. And here, like the enamel, here the dentine part, it is covered by a layer that is called cement. So on the crown, the dentine part, it is covered by enamel, and in the root, the dentine part, it is covered by a cement, and this cement, it is deposited by cementoblasts cells, nothing but the mesenchymal cells. And outside the cement, we have a fibrous membrane is present, that is called periodontal membrane. The green one, we call it as periodontal membrane, which connects the tooth to the bony socket, So in the tooth, when we take the histology of tooth, we will able to see the crown of the teeth, and as well as the root of the teeth, and the greatest part of the tooth, it is formed by the dentine, hardest bone material called dentine. Okay, and coming to the crown, the dentine, it is covered by a layer called enamel, which is the hardest material of the body. The enamel is the hardest material of the body. It constitutes of inorganic salts, nothing but calcium sulfate and calcium phosphate. These salts, they are arranged in the form of hydroxyapatite crystals. Okay, and here this enamel, it is deposited by ameloblast cells. So like bone, one layer of enamel is formed, and further one layer of enamel is deposited, and because of these layers of enamels are deposited, when we take the section of enamel, we will able to see lines which are nothing but the layers of enamel by the ameloblast cells, layers of enamel deposited by the ameloblast cells. These lines are called lines of Regius. And coming to the dentine part in the root, it is also covered by a hard substance called cement, which is deposited by the cementoblast cells, nothing but these cementoblast cells are derived from the mesenchymal cells. And outside the cement, the blue layer we call it as cement. Outside the cement we have periodontal membrane is present. Periodontal membrane is present, and this periodontal membrane which connects the root of the tooth to the bony socket. So that's about the periodontal membrane. And here when we take the dentine structure, we know that dentine is also, it passes the greater part of the teeth, and this dentine, when we take the section of the dentine, we will able to see like enamel. This dentine also, it is also formed in layers by one type of cells that is called odontoblast cells. So odontoblast cells, they form dentine. Odontoblast cells, they form dentine, and we can see the lines here. These are called incremental lines of von Ebner. These lines we call it as incremental line of von Ebner. Okay, and incremental lines of von Ebner, and we can see here nearer to the enamel, this dentine cell, this dentine, it is made up of glycosaminoglycans. This dentine is made up of ground substance called glycosaminoglycans, and collagen fibers are present in the dentine. And here nearer to the enamel, the mineralization of the dentine is less. Nearer to the enamel, the mineralization of the dentine is less, and we call that dentine. Nearer to the enamel region, we call that dentine as mantle dentine. We call that dentine as mantle dentine. And coming to the nearer to the pulp cavity, here the dentine here also the mineralization is less here, the mineralization is absent here. Nearer to the pulp cavity, we call it as predentine lines. We call it as predentine lines. We call it as predentine lines. So the mineralization is absent nearer to the enamel, we call it as mantle dentine, and the mineralization is also absent nearer to the pulp cavity, we call it as predentine lines. And here we can see the nearer to the junction of the root, and also nearer to the junction of the root, we can see a granular layer of tomes are produced. Nothing but the mesenchymal cells are seen here, which appears as the granules. A granular layer of tomes are seen. Nearer to the junction of the mouth, and also as nearer to the junction of the crown and the root, we can see granular layer of tomes. So, and one more thing is the lines which extends between the mantle dentine and the predental dentine, we call it circum. So the lines which extends between the mantle dentine and the predentine, mantle dentine and predental dentine, we call it as circumpulpal dentine. So that's about the histology of tooth. So the tooth consists of nothing but teeth consists of an upper part above the gum, we call it as crown, and the below the gum, the lower part, we call it as root. The greatest part of the tooth, it is made up of hard substance called dentine. In the crown region, the dentine part, it is covered by a layer of hardest material that is called enamel, and this enamel, it is formed by ameloblast cells, like the layer by layer by like the ossification of bone. And here this enamel, we can see when we take the microscopic section of enamel, we can see various lines are present in the enamel, which are nothing but the formation of layers of enamel by the ameloblast cells. These lines are called lines of Regius. And coming to the lower part, coming to the root, here the dentine part, it is also covered by a layer called cement, which is nothing but the cementoblast, which is formed by the cementoblast cells. And this cement, it is connected to the bony socket by a fibrous membrane, by a loose areolar fibrous membrane, that is called periodontal membrane. And here we have this part, we call it as pulp cavity. This pulp cavity At first it is very large. As the formation of dentine takes place, this pulp cavity becomes very narrow, which is traversed by mass of cells as well as nerve plexus and blood vessels. So this consists of, this pulp cavity consists of mass of cells as well as blood vessels are present, as well as nerve plexus are also present here in the pulp cavity. Okay, then coming to the dentine. In the dentine region, because this dentine, it is deposited by the odontoblast cells. Okay, these are nothing but these odontoblast cells are derived from the mesenchymal cells, and these odontoblast cells, they form the dentine by like the layers of bone, and so we can see the lines here in the dentine. We call these lines as the incremental lines of von Ebner. We call these lines as incremental lines of von Ebner. And the dentine, it is made up of hardest material, and it consists of glycosaminoglycans, and then the ground substance consists of made up of collagen fibers. Needed to the enamel region, this dentine is less mineralization is seen needed to the enamel region. We call that part of dentine as a mantle dentine, and needed to the pulp cavity also mineralization is absent. We call that part of the dentine as the predentine, and when the area exists between mantle dentine to predentine, we call it as circumpulpal dentine. And needed to the junction of the gum and root and the crown, we have granular layer of tomes are present. These are nothing but the mesenchymal cells are present. Okay, so that's about the development of tooth.